Good morning, everyone. We're seeing if we have quorum really quick. I guess we'll do roll call and we'll know. I'm Cheryl Ramirez. I'm the chair of the Finance and Revenue Committee of the Universal Health Plan Governance Board. Happy St. Patrick's Day. And this is the final meeting of this committee after meeting for 18 months, usually twice a month. So it's been a really long time. With that, let's go to roll call and see if we have quorum.
Yes, Cheryl Ramirez.
Here.
Chunwei Chi, doesn't look like Chunwei's here yet. Mary Lou Henrich.
Yes, I couldn't unmute it. Okay, thank you.
Hi, Mary Lou. Richard Gibson.
Here.
Thank you. Jeff Goodman.
Here.
Thank you. John Santa.
Here.
Thank you. Bethany Stairs. I don't see Bethany yet. And Charlie Swanson.
Here.
Looks like
Thank
we
you.
have quorum. Isabel, I believe Bethany won't be joining us
Okay.
today. She's on a trip. Okay, with that, I'm going to review the agenda, and then we have 3 people doing public comment before our voting. So we'll move to that after the agenda review. So let's see. First of all, I wanted to note the various documents that we received, just in case you didn't see them. I think just yesterday we got a status quo versus UHP scenario cost calculator. Thank you, Richard, for doing that for us. I thought it was really helpful. And so that will be posted if it hasn't been already. In preparation for the voting, Charlie sent us some spreadsheets on the household size rate readjustment and Medicare Part B. So thank you for all that extra work, Charlie. Appreciate it. And then you should have received an email with our homework over the last week or 2 weeks with the draft final report by Echo Northwest that you could provide feedback on, mostly structural. And on the let's see, the revised reserve memo, and that was a track changes document that you could add your comments to. Okay, so first we're going to talk about the draft final report. Oh, I wanted to make a note that this agenda has changed slightly. We wanted to move to insert the public comment on voting topics at the top. And the timing has adjusted slightly, but the content has not. And you'll note that it says we adjourn at 11:25, but we can take the whole 3 hours if we need. So just want to make that note. So I just want to go over the various topics and our potential votes so we're prepared. So first, we're going to go through the draft final report. We're not voting on the final report, but Echo Northwest will accept further feedback. They're going to finish it after this meeting today, obviously, and then they will accept further feedback for the following 2 weeks when they send it back out. So that'll be sometime early April, and I feel like that's really generous of them. If you have substantive opposition at the point that the board submits its report to the legislature, you can certainly submit any opposition that you have. On the reserve memo, this is kind of your last call to comment on tiers, months of reserves, and pay as you go versus borrowing. We're not voting on it, but you can provide, your last feedback. The third thing, these are voting topics, is the household size rate readjustment. We'll talk about that. We'll spend a good chunk of time talking about it so that we can decide whether we're going to vote for it or not. We will call a vote. And then the Medicare Part B payment, we will discuss and we'll vote on that as well. And then the last potential vote, hopefully we will vote on this, is the basic revenue proposal that would go to the board. So that will be our final proposal. And with that, I would like to move us to public comment on the voting topics.
All right, just give me one moment to I need to pull up the timer.
I think John
Apologies.
has a comment that he wants to make before we do that. Is that reasonable?
If it's brief, we've got to really get to the voting topics. We want to make sure that we're able to vote on everything today. Go ahead, John.
Yeah, thanks, Charlie. And it will be brief. You've made comments about the input from the committee, but not made clear whether that input's going to be shared with other committee members, whether it's going to be public. To the best of my knowledge, any input you've gotten about documents so far has not been shared with the rest of the committee, is not public. You know, hearing that there's going to be the ability to make comments for 2 weeks on a document that it sounds like, you know, will be just a discussion document. Could you just clarify what's going to be public, what's going to be shared with all members of the committee who will now no longer meet? Thanks.
My understanding is all the comments will be public and will be shared, but I will ask Director McDonald for clarification too.
So if you don't mind clarifying, John, are you talking about track changes and things like that, or the that are going to Echo Northwest regarding those documents?
Sure. I mean, in some cases, track changes can be very substantive. Yeah. And on the task force, that's what we did. You know, it was a group effort, team effort, and it was difficult sometimes for everybody to open up track changes because there's different versions. So there's some technical issues.
Yep. Thank you.
I'm just trying to figure out
yes, I understand
how
that.
public is this going to be?
Trying to answer your question. I will defer to Morgan Shook from Echo Northwest since it's his document. And Morgan, if you don't have an answer right now, want to come back, that's fine too.
Yeah, so we're jumping around ahead of that one. I can touch on that. So after this meeting, we're going to finalize that document based on your conversation today, at which point we'll give you 2 weeks, I said. It seems like a good number. Not too long, not too short to edit it. And if you want to everyone to see one document, what we can do is put that document live on Word Online, so everybody can just simply edit as they go. So you'll be able to see everybody's comments and changes in one document. So if folks prefer that process, we can go that way. Otherwise, I was simply going to send everyone and then consolidate and then work through changes with the chair. But I'm happy to do either one. We can talk about that, what the best process is, John, when we hit that agenda topic. So, yep.
Thank you.
Okay, Jeff.
2 brief comments. Number one, I did offer comments. I did a reply all to everybody when the request first came out. I understand it was not received. Number two is I will be making motions with respect to the final draft final report and the reserve report.
Okay, thanks, Jeff. Now let's go to public comment.
Thank you. Yes, so 3 people for public comment today. We'll each have 2 minutes up on the screen, and the first person is Linda Krieger. You should be able to unmute and share your comment now.
Okay, thank you. Can you hear me okay? All right, great. So at the last meeting, the 2 voting topics were discussed. The household size readjustment, as well as the Social Security Part B, or not Social Security, I'm sorry, the Medicare Part B. I agree, and I think that Charlie's document made a great case for why we should look at paying the Part B premium for everybody, and as well that there's a good argument for removing the household rate readjustment to simplify the taxes. However, the other thing that came up that was added to the motion last time that was ultimately rescinded was that we increase the HCPIT by basically 2% to cover those 2 items. And that's something that I think this committee needs to, I think more research needs to be done, more analysis, and maybe some other ways of making up that $2 billion that are going to be needed with those adjustments. Maybe in the form of increased EPT on larger businesses, or a tiered HCPIT, instead of putting all of the burden of any additional revenue that's needed strictly on the HCPIT. I think that really creates a bad precedent, for one thing, for going forward. That's the only lever we're looking at. So that's what I wanted to comment about before the voting.
Thank you, Linda. And next up, we have Alex Polikoff. Give me just a second. Okay, there you go. You should be able to unmute and share your comment now.
Thanks. Can you hear me okay?
Yes.
Great. Well, thanks again to the committee for all your work, and thanks for the opportunity to provide comment. Like Linda said at the last meeting, Charlie mentioned that, 2 points higher than the 10.1%, and I have to agree with Linda. I think that's just a non-starter. The legislature's referred that 6-cent additional gas tax, and everybody agrees that's going down. I think this effort is way too important to just have it shot down right away, which I think it will if the HCPIT is over 10%. So I think, keeping the HSRR in there, whatever it takes. And I think also the thresholds, there wasn't a lot of discussion about those thresholds for both the wage threshold for EPT and the HCPIT. I realize it's got to be 138% to satisfy Medicaid requirements, but that 200% is arbitrary. I think we have to do everything we can to give this a shot, knowing it's going to be worked on and adjusted later. But it's too important to just have people turned off right away with something like 12% HCPIT. And also, I agree that I think I know effectively it's a progressive tax, but I think you do need to have a progressive tax rate in the HCPIT. And also, even at the task force, when the task force reviewed this, they looked at also progressive payroll tax rate. So I think there's a lot of levers that that can be turned and pushed in order to get this effective enough and also reasonable enough that the public's going to go for it. So anyway, thank you for the opportunity. And again, great work for everything you've done. Thanks again.
Thank you. And next up, we have Lou Senator. And Lou, you should be able to share your comment now.
Hi. Congratulations on getting this far. I want to still support the idea of not taxing people differently on family size. But my main concern is I don't quite understand how the governance board will go forward. I don't quite understand how this subcommittee, which has done a very good job. I mean, you really put together a lot of neat things. It's too bad that you're getting closed down. But I don't quite understand how much money the finance committee is trying to get. I hope it's not based on Milliman's guesstimate, because that's a non acceptable situation. Certainly we need to, and I was hoping the finance committee could do this, is point out all the savings that this plan will do. I mean, it will take, 100% off the administrative fees. The administration of this plan will be around 4%, maybe a little more at first. But what is the end goal? If you could answer me that during your progress today, that would be really great, because what is the amount of money that this plan will cost, and how much will it save? Thank you.
Thank you, Lou. And that is all the voting public comment we have.
I just wanted to thank Lou, Alex, and Linda for your public comments. I've been struggling with those particular decisions myself, so it helps to hear from you. So thank you so much. And now we'll move. Mimi, did you have? I didn't see that here, but you're not giving any updates on.
No.
Okay,
Yeah, we
all
just
right.
met 2 weeks ago.
All of a
Thank
sudden,
you.
I saw that was missing. Okay. So we'll move on to the Echo Northwest draft final report. So Morgan, take it away.
Great. Thank you, everybody. A few of you sent some comments on. So I just want to kind of quickly level set. The purpose of sending that large document wasn't to get track changes, comments, but mostly just to see how we were laying out the story, the structure, and to see if there were kind of key places where you think like, oh, great, we need to have a section about X or Y. Just kind of big picture things that you thought from an editorial perspective in terms of just composing this thing are important elements to include. Once we finalize this meeting here, what we're going to do is go back and spend about a week or so to just finalize it and then get it out to you to get your feedback and comments. And you kind of see the structure is we try to start with the kind of the products that you've had, tell the story, and then get to the revenue plan and start talking about some of these considerations. And so the way I think about it is there will be kind of a final recommendation on the revenue strategy. And then I think there's been a level of richness around kind of key issues, key topics that I think that where you will want to kind of make sure you have your voice and both educate the board and the public on what you think these pieces are. So think of it as a way to kind of, even though you have a consensus recommendation, there's a lot of nuance there. And so we want to give you a couple weeks to do that. And I think this is kind of where John said, well, how do we see what Jeff is saying or Richard is saying? The initial idea was simply just to send out that final version and then let you edit and me and have that way I can come back and consolidate all those changes and comments and basically be as sort of inclusive of your viewpoints as possible, right? And maintain what I think is a healthy level of tension amongst viewpoints outside of kind of the things you've recommended as a group. But John raised a point here, it'd be nice to see what other people are saying. So one option would be is simply just put it on a Word Online document and just give you a window to edit and comment so you can kind of see what is Mary Lou saying, what is Jeff saying in terms of comments and edits. I will still have to sort of consolidate places in some of that piece, but at least you'll be able to see what everybody's feedback is. So I guess two thoughts or questions. One, just to make sure everybody understands kind of the process going forward, and then two, opinions, thoughts on how you want to do your contributions to the edits. Jeff.
Who has the final say on the draft final report before it goes to the governing board?
That will be me, I would say, in the sense of I will try to make sure to make the document as readable and clean as possible. Right now, my approach, if there are kind of things where I'm like, is this something that should belong in the report versus a separate letter? I think as Chair Ramirez said, around like, hey, this is a point of view that you want to give to the board. What I'll do is I'll work with Chair Ramirez to figure out what that is, and then kind of work with whoever it is sort of had that sort of comment that I couldn't accommodate, right? That would be kind of, I think, the operating principles and protocol I'll try to move forward with.
Thank you. I just to express my comments on that, I disagree. We should be the group that has the final say before it goes to the governance committee.
Thanks, Jeff. Any other questions, thoughts, Mary Lou? I saw you nodding in terms of the process. Okay.
I was just saying that kind of the track change word thing that we
Yeah.
can see would be helpful. I think it's messy and all that, but I think if that can be done, it is good, since we can't all be chatting with each other all the time, to really kind of see what so-and-so is thinking on this and go, oh, well, maybe that is something I hadn't thought about. So thank you.
Chair, sorry, Mimi, you probably have something.
Sorry, yeah, just to notify the committee that we'll need to double check regarding public meeting laws, because if the entire committee is deliberating on a product, it may be that that's possible, and just that the document that has everyone's comments then gets posted. But I just want you to know that we'll just need to look into that with our public meeting law experts. Thanks.
Yeah, thanks, Mimi.
I would just offer that if the committee truly is over today, that's one of the, I think, the questions and the concerns is about how we do this when we are finalizing the committee today. It goes away. So it really isn't a committee anymore. It is confusing, Mimi. And
yeah, this is the last committee meeting. This is the last committee meeting. The committee hasn't been officially disbanded.
Oh, okay. I had not understood that.
Charlie.
I mean, my preference is also, I think what Mary Lou was saying, that we are able to see everybody else's comments, and also the process that you're doing to resolve some of those comments and sort of have it be a live document. And I do appreciate Mimi's question about, well, can that work with public meeting rules? And if it's open to the public to see it as well, but not comment on it, is that okay or not? And I guess we'll have to find that out. But to me, that would be what I would like to see happen, but it may not be possible. So
yeah, I'll say, Charlie, from my point of view, I would say I'm trying to make it more expansive. So if people think of it as basically, I know where you voted, and that's where you agree. And if you have kind of other things that are points, I want to make sure we cover that, like call it in a kind of key considerations. Some of that may not be like narratively flow, but like, hey, there are 10 points that the community members raised with respect to X, whatever it may be. Here's what those points are. So I'm trying not to sort of like, arbitrate versus what's in and out. But I think in places where it's like, to me, it's like, this is not part of the report necessarily. Maybe there's a comment that's important, but it doesn't necessarily live thematically within the report, would be the places where I'm just trying to adjudicate with Chair Ramirez. Go ahead, Jeff.
I'll defer to Cheryl.
Okay.
Oh, I just wanted to say that I'm happy to facilitate that process as long as we, stay within public meeting law, whatever we need to do. I think that's a great suggestion, and I'm happy to help make sure it's everyone can see it if that's possible, and that it's public too. So I'll work with Morgan and Mimi on that.
Okay, thank you. Preface my comment, the effort that we are undertaking is a noble effort to try and provide coverage for all Oregonians on a more or less equitable basis. It is a noble effort, and I support that effort. But the motion I will now offer is that we vote, the motion is to not accept the draft final report, 90-page plus, as submitted.
Okay, Jeff made a motion. Do we have a second? John?
I second the motion.
Okay, we have a second. Any discussion? Charlie?
yeah, I'm going to move to amend that motion. And the way I'm going to move to amend it, and I'll just read off what I wrote down, at least as a starting point. And that is, Echo Northwest's report on Finance and Revenue Committee's recommendations to set up the Universal Health Plan Governance Board describes in part the work of our committee. The committee does not have time to appropriately approve or disapprove of the report, but we'll provide Echo Northwest with comments and suggestions with the understanding that it is up to them to include at their discretion in their report. The committee acknowledges that we did not complete our work to the standards of the guiding document the Universal Health Plan Governance Board approved on January 10th, 2025. We further acknowledge that we only completed the first 5 bullets of the tasks as outlined in our charter as approved by the Governance Board on July 18th, 2024, and only the first of 2 deliverables described in that charter. We reluctantly accept the board's decision to disband the committee before our work was completed.
Well, first I'm going to ask Jeff if you accept the amendment.
So much for brevity.
I know.
There are so many moving pieces. I mean, I appreciate, Charlie, what you have written. It has way too many pieces in it for me to accept it as a friendly, if you will, or amendment. I think we are better served by simply saying the report as presently submitted is not acceptable. That does not preclude changes going forward with what the Governance Committee does with that document. It does not preclude work that the Transition Committee will do. It is a simple statement incorporating all of the comments, Charlie, that you have, and says, no, it is not acceptable in its present form. So thank you for the suggestion, but I cannot accept the your comments.
It is not intended as a friendly amendment. It is intended as a replacement amendment. So it's intended as a full amendment to the thing, not as a friendly amendment. So,
Okay.
yeah.
So,
And
my
Jeff-
apologies for using the word.
Yeah. I mean, so it could have, it could have been accepted, but that was not my intent. I didn't expect it to be accepted that way. So it is a motion to put forward an amendment, and we'll see what goes with that, happens with that.
And we're still friends.
Yes, obviously.
But Jeff, you're not accepting his amendment. So
I am not. I
seems to
appreciate
me-
it, but I am not.
It seems to me that your motion still stands as is, seconded by
It
John.
can be amended, and he doesn't have to accept it. It can, if somebody seconds it, we can discuss the amendment.
Okay. Does anyone second Charlie's amendment?
I second.
Okay, Richard. Richard seconds Charlie's amendment. Any other discussion? Looks like Mary Lou has her hand up.
Well, I'm just a little confused
Yeah.
about, I didn't think we were voting today on the 90-page, I'll call it the 90-page report, okay? And so that's where I'm kind of confused, Jeff, is like accepting or non-accepting that report. I'm just confused.
Certainly.
Go ahead, Jeff.
I think I can respond to that. Number one, I think on a previous draft agenda, it was going to be voted on. So that was number one. And agendas change, I get that. But number two, on any item that we have discussed over the last 18 months at any of our meetings, even if something is not on the agenda for a vote, we, you, or any of us on the committee can bring something up and say, we'd like to have a vote on this. So
That's
that
true.
is my reason for bringing it up.
Thanks, Jeff. Any other comments, Mary Lou, on either of the motions? Just want to give you the floor if you want to say anything else. You're on mute.
I was
And
just
just so
trying to get
people
my
know,
hand down.
sorry, I put Charlie, I hope this is acceptable with you. I put your amendment in the chat so people
Oh,
can
that's
see
helpful.
it.
Thank
Yeah.
you. Mary Lou, did you have anything else? No?
No.
Okay. Richard?
I thought that the one that we would approve or not approve would be the 4-page revenue, not the 90-page, because we just talked about sending the 90-page out for revision. So I don't understand how we could approve or not approve something that we're sending out for people's comments. So yeah, I'm confused about that.
Yes.
To that point,
agree with
we can vote, we can still have it be sent out. There's nothing precluding it from being sent out. It is simply would then now be sent out that's saying we as a committee do not approve it in its present form.
Okay. Charlie?
I will say that Echo Northwest has to provide a report. I mean, I would expect from their contract, they're going to have to provide a report. This is essentially Echo Northwest report, and that's what my amended version is trying to say, that yes, it is describing the work of the committee, but it is a report from Echo Northwest that they're going to have to provide. And whether or not we accept it isn't going to matter in some ways. I mean, we can say we don't accept it, but in its present form, and we won't be able to take a vote on whether we accept it later in its revised form. We'll just be able to say, make some comments on it. That's all we can do. And so to me, what I am proposing as an amended version is essentially saying, yeah, it's not our report, but we are commenting on it. And we have some things that we didn't accomplish, unfortunately, and we want to publicly acknowledge that. So that's the purpose of what I'm amending to say. I would be fine if we do not take a vote on either of these things, but if we're going to take a vote, I want to take a vote on the amended thing, my amendment first. So
I just want to break in. I do agree with how you're perceiving this, Charlie, and I do want to note that the board will formally accept the report. That is the board's responsibility. I do think, from my perspective, that Charlie's motion is completely different from Jeff's, and so it seems like a whole separate vote to me. But John, do you have something?
Yeah, I just wanted to clarify what I think Charlie stated, which this is our last chance to vote. You know, while we may be able to see other revisions, this is it in terms of us voting on anything, this meeting. Given what I've read and seen, my major concern is the report asserts that we've made progress on a financial plan. And a financial plan includes a lot more than a revenue plan. And I just can't support that. And that's why I'm a no. While I agree with Charlie's statement, I don't think it's as emphatic as it should be. We've developed a revenue plan, and we're going to talk about that later. We haven't developed a financial plan. And so that's where I'm at. Thanks.
Thanks, John.
And just clarify, this is it in terms of voting. Charlie's statement was correct, right? Does everybody agree with that? This is our last chance to actually vote.
Yes.
on something. Yeah. Okay. Thanks.
Jeff?
Sure. Just one example of why I've made the motion is as simple as it is. The 90-page plus document from the very get-go, and our committee from the very get-go identified 18 principles that we wanted to incorporate. That's included in the 90-page report that will go forward. And I acknowledge that. It is going to go forward whether we vote yes or no. But of those 18 guiding principles, we're in violation with this report on the recommendations we have on at least half of them. So for us to say collectively that this report should go forward is something we should not do, because it implies that we have accomplished things in the report that we have not. There are other reasons, but for us to go opposite on more than half of our guidelines is not something that we should have put our endorsement on. But thank you.
Okay, thanks, Jeff. I'm going to need help by a parliamentarian. Do we move forward on the motion of Jeff first and vote on it, and then move forward on a vote for Charlie separately? Can anyone?
I believe the answer to the question is yes, because since I did not accept Charlie's modification to mine, even though there was a second, it's not, so, and my motion was the first one up, so I think that's the one that goes.
Okay,
That is not my understanding of Robert's rules. It's the other way
Okay.
around from my understanding, but it would be nice to have a parliamentarian. Do we have one?
yeah, that I don't know. That's,
I mean, I'm fine either way. It's as long as we have a vote on, and if we have a vote on both motions,
Uh-huh.
that's fine. That does not a big deal to me.
Charlie, by the opposite way, what do you mean that we would vote on your,
I mean, I think the motion to make an amendment to a motion supersedes the original motion. And if you, so you,
Yeah,
the
does.
only, you can't, if you have an amended motion. Now, I guess the question is, can it be, if it's a complete change like this, which it is, can it be considered as an amendment? And I do not know the answer to that. I think that it can be. I think you can amend it any way you want to amend a motion. And the amendment has to be voted on first, otherwise it's not an amendment to the motion because the motion gets voted. So, I mean, that's my
I see what
understanding
you're
of
saying.
Robert's
that
rules
makes
of order.
sense. Yes, yes,
Yeah.
that makes sense. You're
Yeah,
right.
Charlie, I am persuaded to your argument. It's something that happens often in Salem where it's what is it? Gut and switch.
Yes, exactly. Yeah.
Yeah.
Gut and stuff. Gut and stuff is what they say. Yeah.
Gut and stuff. Thank you.
Yes, yeah.
Right.
My
And
tang got tangled.
I just want to say, I feel like I haven't been able to digest Charlie's amendment, having just heard it now. I realize you sent it earlier to Mimi and me, but I haven't really digested it. I accept what you're saying as being accurate, but I haven't. I mean, it's a pretty dense amendment. So I wanted, and then I also want to remind all the committee for either of the votes, you can also abstain. That's another vote that you can have. I'm glad we have 7 people today.
And Cheryl, you mean dense in terms of complexity, not in terms of intelligence.
No.
Yeah.
Complexity for sure.
Yes.
Yeah, I would never question Charlie's intelligence. Yeah. Okay. So any other discussion before we call the vote? Okay, let's.
Wait, hang on.
Go ahead, Marilla.
I'm trying to read it in the chat. Is that entirely just all that's there? It seemed like it was longer when he read it.
Let me.
But it's like
No, it's all there. Yeah.
It's all there. Okay.
And so it also includes live links in the chat to the guiding document, and you can,
Yeah.
but that's the long one. That's has the 18 points that Jeff mentioned that we only lived up to maybe half of them, if that.
Less than half.
Less than half, yeah. But then the more specific one is our charter, and you can see in my mind that we have accomplished 5 of the 8 tasks that were set out in our charter, and we delivered we are delivering, I guess, one of our deliverables, one of the 2 deliverables, and we have not done the other one. So that's essentially what the second paragraph of that says.
Okay. Thank you. I read it.
I would,
I read
Charlie, I'm sorry, Charlie, I would point out, though, that is a different interpretation than what the governance committee told us a couple meetings ago, that we had accomplished all of our deliverables.
Yep.
And you are on the same page. We have not delivered on all of our deliverables.
Yeah, I mean that to me is pretty clear from reading what our charter is. So yeah,
Yes.
I just went by what the charter says and what we did.
Okay. Mary Lou,
Yeah.
go ahead.
Okay. And I guess that I'm still, my head's spinning a little bit on all of this. And I'm trying to understand, to whom are we giving the message that we are frustrated as a committee, that we were given a charter that was approved before I ever joined this group, that we've worked incredibly hard. People on this committee have worked incredibly hard. Morgan Shook has worked incredibly hard. And we now have his first draft of a 90-page document that I'm understanding that it's still in play and that we're having time to input to it and hopefully be able to see what we're all thinking about it. But we won't have the opportunity, as John has pointed out, to vote. This is the last meeting. So I think just the process is difficult. And I read that report carefully. I didn't really comment, Morgan, but honest to God, I have a million notes. Okay, send this to the transition committee. What does this mean? How does this work on this? So so I'm glad we still have, opportunity to kind of maybe put those kinds of thoughts out there. I'm sorry I'm babbling, but I'm
No, you're
really
not.
okay. So I'm trying to kind of frame it in terms of, no, that report, there are things in it that the way it was stated sounded like the committee had done some things that, to my knowledge, that we really didn't do. That it painted a pretty good picture and light of what this committee has tried to do. But to me, they weren't things that were like gonna say, oh dear, this isn't, the report I can support. But it also feels to me like this is Echo Northwest's report. It embodies what this committee has done or not done. And so I'm just kind of confused, I guess, back to Jeff on why are we going to vote for this in-process report to either be accepted or not accepted. I do like kind of Charlie's wordings, kind of acknowledging, so for the public to know that this committee really wasn't able to finish the work that was laid out. And kind of to say, I think some of this is maybe to have the ability for public that's watching this or looks at it later to realize this committee did its best to get us to where we are, but we aren't finished. And so a lot of my notes have to do with sending this to transition. And since I'm going to be on the transition committee, I'm talking to myself. So I'll end with that.
As long as you're not answering yourself, you're good.
We won't talk about that. Okay.
Mary Lee, to your question as to why we are voting, this is no different than a vote which we had several months ago, where we voted as, I believe we voted as a committee, or we sent a recommendation, went up to the governance board to say, rather than trying to do a 100% single payer universal health care, why don't we focus our efforts on that 3 to 5% of people we are not covering in Oregon, which we want to get them covered. And the governance board came back and said, no, this is what we want you to do. So a message was sent up and a message came back. Voting on my proposal, the no vote, is another way of doing that exact same thing. Even though we are being disbanded, it is simply saying to the governance board, we aren't happy. You can change it if you want, but we aren't happy.
Okay, so I'd like to call the vote on the amendment, and I do see in the chat, I kind of read that very quickly, that Charlie is indeed right, that we vote on the amendment first.
Okay,
So,
good. Thank you.
could we do the vote, the roll call vote? Thank you.
Yes. Cheryl Ramirez,
Yes.
Chenwei Chi,
Yes.
Mary Lou Henrich,
Yes.
Richard Gibson,
Yes.
Jeff Goodman,
This will come as a complete shock to everyone. No.
John Santa,
No.
Bethany Stairs is absent, Charlie Swanson.
Yes.
Thank you. So that passes.
So that's
Didn't
if my math's
Chenwei
right.
Chi
He
join?
voted. He voted. So that's 5-2. Is that correct? Just want to note that for my.
Yeah, that's correct.
Okay, now let's go to, so motion approved, motion passes.
Well,
So wait,
now
that's
we
the
have to vote on
motion
it.
to make the amendment. Now we have to vote on whether we accept the motion as amended.
That is correct.
Oh, okay, I'm sorry.
It's been gutted and stuffed. Now we need to vote on the gutted and stuffed.
Yes.
Okay, all right, thank you very much for helping me out. Okay, let's vote on the amendment.
Okay.
Okay.
On the
Cheryl
amended motion is what you really
Yes,
say, yeah.
amended motion, yes, sorry, the amended motion, yes. Okay, go ahead.
Cheryl Ramirez,
Yes.
Chenwei Chi,
Yes.
Mary Lou Henrich,
Yes.
Richard Gibson,
Yes.
Jeff Goodman,
No.
John Santa.
No,
Bethany Stairs is absent. Charlie Swanson.
Yes.
So that's 5-2, that passes.
Okay. So are we voting on the original
No.
motion or not?
We're
We
done.
did.
We're done. Okay, all right,
Yeah.
got it. Okay, thank you. That was a little complicated.
Yes.
Charlie, go ahead.
So I've got some comments that I would say they're kind of on the structure of the report that I did not send in early. I mean, I did send in some things early and I have a whole lot more to send in later. But the part of the structure, I mean, the first chapter goes over a lot of aspirational things, which I think a number of us recognize we didn't really do. And it doesn't really say that we didn't do them. It's more like, yeah, these are things that we could aspire to have done, and it would be good if they got done before the governance board made its report. I think it would be useful to put in a little bit more about that. Yes, these are some aspirational things, and to make it clear that we're not implying that the
Committee.
that Echo Northwest is not implying that the Finance and Revenue Committee considered these things appropriately. I mean, just as a small example of one of the things, one of the things in when you're creating a tax structure you would like to analyze is the volatility of it. Does it change from year to year, and and that's appropriate to do that. That wasn't done. I mean, we can do, and I think maybe even a little bit of that could be done. I've done a little bit of that, but I haven't shared it with the committee yet. But as an example, the volatility of payroll in Oregon over the last 20 years has been pretty small and probably something we can live with. The volatility of the total AGI in Oregon is substantially larger. And so the fact that we have put a huge amount of the onus on wages actually decreases the volatility compared to the AGI. And I mean, so that sort of analysis can be done. We didn't do it. And it probably should be done at some point going forward. So it would be nice if a little bit more clarity was given to what was done and what's still aspirational. So I'll just sort of stop there.
No, that's a good sort of like narrative framing piece, and I think your motion goes a long way towards sort of helping clarify that beginning section, Charlie.
As a follow-on to Charlie, and I agree with his comment, it's that just another example. The revenues in this report are overstated because they do not recommend dynamic. It is a static analysis. It is not dynamic, and doing a 10%, 12%, 8% will have an impact on the revenue. So the report as presently presented overstates revenues. And I've stunned everybody into silence.
Go ahead, John.
yeah. First of all, I want to say I'm happy that all the folks who voted for the amendment are either on the board or on the transitions committee. And so now the accountability is yours for making sure that a report that actually 4 members of the committee have now acknowledged in their public comments contains statements that don't accurately describe what the committee did. That's pretty serious. That's pretty serious. We need to go forward now and sort the rest of these issues out. I would, because I think this is probably my last chance for substantive input. A couple things that I would urge be changed is that the term alignment is used. And there simply was no alignment that we ever were allowed to accomplish. We never met with any other committee In fact, we hardly reviewed any of the documents from any of those committees. There was never alignment over any cost issues. And inferring that there was any alignment, I think again is simply not true. And I believe, Morgan, I think you used kind of a bit of a reworded version of the principles or all. I wouldn't do that. You know, I would use exactly what was stated, because that's what we voted on and we passed. And while some of that language may now be awkward, I didn't do a word by word comparison of your retelling of those components, but I wouldn't make any changes in that. So that's my final word. Thanks for this discussion, everybody. Appreciate it.
Thanks, John. Charlie.
So related to Jeff's question, I guess I have sort of a question for Morgan that he may or may not be able to answer. So does LRO have the capacity to look at some of that dynamic modeling, or is that not, I mean, I agree with him that when you have a tax of that size, can they do dynamic modeling? Like, well, what effect will that have? What's our guess as to what effect that will have on behavior, and what effect will that have on revenue? And is that something that LRO does typically and can do?
I would say it's something we've talked with them in the past about, and it will really depend on the tax. So I would say, and don't hold me 100% to this, my memory might not be clear, but for some of the taxes where we're making sort of small marginal pieces, right? The models work within their bounds to be able to kind of provide some of those estimates that you're talking about, right? Well, how might this look over some period of time given the dynamism in the economy? I would say perhaps maybe with the personal income tax rate, right? They just don't have any data that would suggest sort of how it would dynamically sort of shift with respect to sort of like what the true elasticity might be. So, but it'll be something, think of it as basically all those kind of measures around sort of the tax efficiency, efficacy. We'll want to ask them about what they can do in that process. Okay, Jeff.
Thank you. Number one, the 2022 legislative report acknowledged the need to do this. So it was known early on. Number two, Morgan, your own firm with Mike Wilkerson issued a report earlier this year doing an analysis acknowledging that particularly in Portland and Multnomah County, one of the reasons people are moving is the additional taxes that have been put in place over the last few years. So from two different sources, this should be able to be done.
Thanks, Jeff. All right. Well, I thank you very much for the conversation on the report. Oh, okay. I see Jinwei. Go ahead.
Thank you. I just want to make a more general comments. I think both this committee and Echo Northwest, when we embark on this massive task, we were faced and still are facing one major constraint or limitation. That is, we don't know what is our boundary or limitation on taxation. And that's the information I have been repeatedly advocated the board should ask the legislature to appropriate revenue. We need to take a gauge of what Oregonians think is acceptable additional health income tax, personal health income tax. So we are operating, both the committee and the Echo Northwest, we are operating without that information. And I will bring this issue to the board. And my real concern, persistent concern, is after we've done all those hard works, and then our whole plan will be rejected by the voters or legislatures because what we propose taxation is way above what Oregonians feel acceptable. Ideally, we should have a gauge on what range of additional personal health income tax deemed acceptable by Oregonians, particularly the middle 3 quintile, the so-called middle income, the second to fourth quintile income group. And then with that, it will help us to guide both on the revenue side, but also on the cost side. What saving, what cost can we generate with the universal health care? At the same time, in terms of projecting the revenue and costs, it gives us a boundary that we have to operate within that boundary. And so I just want to acknowledge that we are facing this huge limitation that limit our scope of work. Thank you.
Yeah. Thank you, Chenwei. Okay. Let's see. Go ahead, Charlie.
So I would say we may or may not have some idea of that number. And I would say, where can we get an idea of what that acceptable number might be? And my contention is that that the amount that they're currently paying for healthcare, essentially in premiums or out-of-pocket costs, is close to the amount that they would be willing to continue to pay if they had a better system. And so our estimates of our comparisons to what they're paying, people are paying in the status quo compared to what they would pay in new taxes, I think are at least a good approximation of what's potentially acceptable to voters. And our analysis with the current taxation, with a bunch of caveats that relate to some of what Jeff was saying, that we don't know, we don't have dynamics of what that taxation will do, would say that for 60 to 70% of the people, they're going to be paying less with the universal health plan than they're currently paying in the status quo. And so I would posit that is probably acceptable to most of those in the middle quintiles. But again, that's a guess. We haven't done any focus groups or any polling. There actually has been some polling done in the past on that voters would accept a large tax increase in Oregon to have a better healthcare system. And the tax increase that was in that poll was on the order of twice to 3 times as high as they're currently paying. And also we can do an analysis and says that the tax we're proposing is lower than is less than double their new taxes for about 70% of people. It's more than double for about 30%. So I would say all of those give us some indication of what we're proposing is within a potentially acceptable range. I'll stop there.
Thanks, Charlie. And Jeff, then Mary Lou, and then I know I'm just looking at agenda topics and we have meaty conversations, so I do want to move us along here. But go ahead, Jeff.
I'll defer to Mary.
Thanks, Morgan.
You're on mute.
Yeah, I will lower my hand. I'll just say that I do agree with Charlie. I think a lot of the issue will be about communicating this, that it is a restructuring, that it is not a new something. It is like you've been paying over here, now you're going to pay over here, and actually you're going to pay about the same or maybe a little less, except for the group that's up at the very high end. And that is, I think, at least as I understand what we've proposed and how it will work out, but it really is around, and I guess I'm hoping that some of this feedback will come from these focus groups that we're, I think, embarked on right now.
Yeah, they're already starting.
That's what I've heard.
Oh.
And so anxiously waiting to see kind of what kind of feedback is coming. And some of these types of questions were listed as questions that would be asked in at least some of the focus groups. So, we're in a difficult spot right now. I'm just trying to kind of not panic. Thank you.
Yeah, but we'll let communications do their work. So that's what they're here for. So, and I just want to say again, the cost calculator that Richard came up with is really helpful and very easy to understand. So I think that's what we need to bring, to the general public too.
With respect to that, both the cost calculator and the comments about what the public will or will not based upon the focus groups, we should not leave the meeting today without being able to say to the governance board and to the transition committee, if you are a single person and you're the only one filing, here is the point at which you pay less, and here's the point that you will pay more. What is that dollar amount? Give or take. And we should be able to do the same thing for a married couple with 2 children. If your adjusted gross income or your taxable income is this, you will pay less. If it's above that, you will pay more. We should have those 2 numbers included in the material, included in our report, in our meeting today before we leave.
John and Charlie.
Yeah, well, since kind of a new topic has come up, which is communication, I would just want to say for the record, maybe I missed the meeting, but despite I think being promised that we would have input and be involved in the communication process, I don't think we've ever gotten any information about the communication process and how it would represent our work. We've never had any input. I agree that Richard's calculator is impressive, but this is the first time, this is the first meeting, and we're not going to discuss it. We don't have time to discuss it. So to the best of my knowledge, the committee will have never weighed in on a communication tool. And actually, my own experience sending materials out to other folks is pretty consistent feedback that they could not understand what we were doing. And some of the comments that we have suggested the same thing. I'm not surprised. Communicating about this is incredibly difficult. But again, for the record, this committee had no input into that, no alignment with that, as far as I know. Maybe I'm wrong.
I'll just break in here that Mary Lou and I were interviewed by the communications consultants to give feedback on 2 to 3 questions that they were going to ask groups. So we did provide input. I also understand that there will be a work group, maybe including Richard, I'm not sure, on further developing the cost calculator in the interim. That's my understanding.
Charlie, then Mary Lou.
So regarding a couple of Jeff's comments or questions about a dollar amount that, above which you would pay more, I provided that information to this meeting with, so it's in that material. I forget the exact numbers, but it is in the material that I shared with this group.
I agree, and I wanted to get it in the discussion so the whole group would hear what those 2 numbers are. Single, married couple, two children. Wanted to have it out in the public because not everybody watching this meeting or not everybody on the committee always has the chance to look at the material in advance.
Okay.
All right, go ahead, Mary Lou.
I'll see if I can bring that up at some point. I'll have to look at it a little bit more. Maybe somebody else has it handy.
During our break.
Okay.
And maybe
Yeah.
you could put it in the chat, Charlie. That'd be great.
Okay, I will do so if I find it at an appropriate time, soon enough anyway.
Thank you.
Thank you.
Mary Lou, last word.
Okay, I just guess I wanted to clarify for the rest of the committee that the reason Cheryl and I were asked about that is because we're board members. And so, and Cheryl being chair of this committee. But I do agree that and a document has been prepared as a background document to be shared with the members of those focus groups. And as a board member, that first, I guess I would call it a draft of it, but anyway, that background paper was shared with board members, and we have been asked not to share it with anyone else. And I have respected that request. However, I do think that it would be helpful for people to be able to see it, because it does answer some of these questions. It does give examples of, and apparently Richard was involved, I understand, in developing those examples of what would a family of this kind and that, and what would a single person, et cetera. And they were included. There's a lot of stuff going on out in the atmosphere about a calculator and various people, advocates and others developing things. And kind of, since I sit in kind of both worlds, I get all of this different stuff. And what I keep thinking is we can't really have a calculator until we figure out the other remaining questions that we have about, is it this, or do we have this household rate readjustment in there or not? Or do we do these things? Or at least saying very clearly to people that this is so preliminary, and these are the questions, and these are the additions. I don't know. I'm just I'm trying to kind of hold some advocates back from producing something and getting it out there, and then having to later defend and say, no, that was really back in March, and this is now. And I guess it's just back to the old thing of, watching sausage be made. And I think we're in the middle of that, and everyone's doing their best. And I guess I feel, pressure from all sides. And I know that people like Mimi and just all of the committee members that do interact with other people that know you're doing this, and they're questions that we really can't answer yet. And it's very uncomfortable time.
It is uncomfortable, and we are in the middle of it. So I appreciate that comment, Mary Lou.
Yeah,
And we've
that's
had
all.
other committees working really hard too. And it is the board's job to knit all the committee recommendations
Right.
together before we can come up with a final cost calculator. So Morgan,
And
did you?
One last thing. I just want to reiterate that I do think that the process, at least since I've joined, that some of the things that really apparently were promised to this committee before, and actually kind of during my time, about getting together with the plan design committee especially, that didn't happen, I think is really unfortunate, because I think we've got, we're defined this revenue over here and the plan over here, and then kind of Milliman in the middle of it. It has been frustrating. That's all.
Thanks, Mary Lou. Go ahead, Morgan.
Thank you.
Next
Right.
topic.
I'll move us over to the next topic on the, call it, work in progress reserves memo. And so just to kind of level set, the idea here is for it not to be a final document. It will be a document that is moving into the transitions committee. And so the opportunity here was to review, obviously, the much larger memo where we did a bunch of research on sort of comparable programs and reserve setting, key issues, the work that we did to kind of just say, okay, well, given all that and the uncertainty, here's how we might think about a range of potential financial policies around reserve setting, and given some of the issues that will be dynamic over the years as the plan kind of forms, and then think about sort of how to fund and or finance that, given our sort of kind of capital stack, right? The three tiers of kind of different elements of opportunity costs. And so I want to say thanks to folks that provided some feedback to that. And I'll quickly summarize what I think are 3 points. And then I think, John, maybe I want to call on you just to kind of touch on a key piece that you raised that we'll want to track. So I think the first thing I think is, Hertz says basically, this needs some additional sort of effort and support from folks at the state budget level who can really have better visibility and understanding around how this may actually kind of work in practice. And so that will be something I think that will be part of that transition committee, is to take the work that's been done and provide a kind of professional state budget perspective on both the plan and sources to get that into another level. I think the other key piece is really just about how we talk about the potential sources. And so I think the tiers rider basically, can one use the existing sort of state dollars as principal reserves? So like whether it be the rainy day fund, right? Is kind of our tier one. Our tier two, I think, were places where we talked about, well, could we do some short-term borrowing again? So it's not necessarily to capture those reserves, but to sort of borrow against them at sort of potentially low cost. So those are dollars that are there. What are the abilities if they're not kind of, using them initially? Could we kind of access them in a way that would obviously keep them whole, but also provide some support for the plan? And then our last one, right, is really about sort of putting new dollars into the system and actually to fund those pieces. John raised a real point, just from being some, I would say, making sure we're both delicate with the naming of those, which funds we're naming, particularly in the tier two places, around sort of key partnerships and making sure that there's sort of the right level of sensitivity as we kind of continue to work in that space. I don't know, John, you want to add any more to that?
No, thanks, Morgan, for that mention. Probably the only one I would want to make sure that the whole committee understands is when we're talking about the tribes, we're talking about sovereign nations. And so when we talk about, their reserves, that's another country's reserves. And, suggesting that we might try to get access to those, just is something you don't do. And the others are really, as Morgan described, reserves that potential partners for us going forward have. And I don't think we want to be communicating to potential partners, not potential, some of them will be partners, that we're going to try to get their reserves. So that's exhibit 3, I think, and I urge that that be significantly amended.
Okay. Thank you, John. Jeff.
We're a Finance and Revenue Committee, at least for another 1 hour and 47 minutes. I think we should take a position on the reserve report as to whether it is 1, 2, or 3 months, as you wrote about it, or whoever wrote it, recommended that we should make a decision about that. And so I will offer a motion that the reserve target be 2 months of operating expenses.
Okay, Jeff made a motion. Do we have a second?
Second.
Okay, John. Okay, discussion? Jeff, go ahead.
Thank you. We need to have some level of reserves. This is a very basic finance question. Words by themselves without establishing a number is contrary to what a Finance and Revenue Committee should do. It can be 3 months, it can be 1 month, it could be 2.5 months. We need to establish our recommendation, understanding that it can be changed by the Governance Committee or the Transition Committee. Number 2 is when you look at the detail of level 1, level 2, and level 3, even if we were to achieve all of the possible dollars and being generous in the assumptions on levels 1 and levels 2, we would not get to 2 months. So this is so anyway, so although I'm going with 2 months because that was sort of the implied recommended in this report, we need to just coming back. I apologize for the break there. We need to make a recommendation, and just to acknowledge that at 2 months, tier 1 and tier 2 doesn't do it, even if we got all of them.
Thanks, Jeff. Chenwei?
Regarding reserve, there are, I'm using Taiwan's experience as an example. There are 2 levels on the stipulations. The first level is recommendation. The second level is the legal foundation to raise tax. So in Taiwan's case, it was written into law, the National House Insurance Law, that the first level recommendation that the National House Insurance Fund maintain 3 months, 3 months of expenditure reserve. So that's the recommendation. But then the second level is more restriction. That is, again, it was written into law that if the reserve is below 1 month, then that's the time to raise tax. So do we just want to make reservation? Do we want to just make recommendation about the reserve, or do we also want to recommend when to raise tax?
Depending upon the outcome of the first vote, thank you for reading my mind. Depending on the outcome of the first vote, my next motion would be on that topic of what is the trigger and what happens with the trigger.
Any other discussion on Jeff's motion, Charlie?
So I'm gonna hope that this might be a friendly amendment to Jeff's at this point. And that is essentially to say pretty much what Chunwei says Taiwan did, and to say that the recommendation is 3 months, and that we would recommend there being a trigger at 1 month. I don't know what a trigger would mean in Oregon law, because I don't know that you could pass a revenue proposal that had such a trigger that wasn't completely voted on again. But anyway, to me, it seems like Taiwan is a good enough example that we could follow what they did, and I would wonder if Jeff would accept his friendly amendment to change it to what Chunwei proposed, or said Taiwan did, not necessarily
Do you
proposed.
accept the friendly amendment, Jeff?
I want to get clarification. I think I heard you say, Charlie, you would change it from 2 months to 3 months,
Yes.
and you would add a trigger, unidentified, but add a triggering event in.
A trigger at a 1 month level. It's kind of, so essentially following what, but I actually want to hear from Chunwei before I really say that. So
Okay, but
Yes,
right now it's 3 months of reserves and a 1 month triggering is what you're
Yes,
asking me to accept.
I want to clarify about Taiwan's legal requirement. The 1 month trigger is to give the government legitimacy to raise tax. But since Taiwan has implemented that universal healthcare for 40 years, last year they celebrated 40 years. In 40 years' time, not a single time, when the reserve was below 1 month, the government immediately raised tax. So that's just give the governing body a legitimacy to raise tax, but the governing body doesn't necessarily have to raise tax whenever that trigger point reach. So that's the reality in Taiwan.
Thanks, Chunwei. Okay,
So to Charlie's request to go to 3 months of reserves and a as to be identified triggering event for 1 month, I will accept that in place of the one of I said of just 2 months.
okay, thanks, Jeff. Mary Lou.
Well, I'll be a no vote on this. I just don't think 3 months is achievable. And I'll give it an example that back when I was at Multnomah County, and it was called MCOs before CCOs in those days in the early 90s. And OHSU and Multnomah County decided to form something that ultimately became Care Oregon. And that the state at that time that you had to apply to become one of these organizations, kind of said, okay, which is it, Multnomah County or OHSU? Who is the deep pocket? Who is it that if this doesn't all work out, where does the money come from to pay the bills? And so it ultimately was decided that Multnomah County would take this on and made it a separate division away from the county general fund, and where the monthly premiums came in and we paid the bills. It took 3 years, but we were able to finally get enough reserve in an ongoing basis, taking it out of each premium that came in a certain amount. And we then spun out the Care Oregon from being really truly Multnomah County. And I remember Beverly Stein, who was the county chair, saying to me, Mary Lou, you mean if the actuaries are wrong, that because we had clinics all over the state, federally qualified health centers, that I'm going to, as Beverly Stein, county executive, send property tax from Multnomah County to Klamath Falls? And I said, well, technically, yes, but it's not going to happen. Thank Lord it didn't happen. But I guess what I'm saying is we kind of had what we considered the full faith and credit of Multnomah County being responsible for if this thing didn't exactly work out. I'm not sure how that ends up being at the state convincing, and how much we really have to have, kind of sitting in the bank in case of disaster. But I'm just uncomfortable with not really knowing and understanding yet even how we would get there. Some of the stuff that Morgan put forth, I kind of went, well, that's a leap. So I'm just going to vote no, just on the principle of not whether it's 2 months, 3 months, 1 month. The kind of trigger mechanism sounds really good to me, Chunwei. I can't quite imagine it in the state of Oregon. But at this point, I could either abstain or vote no.
Yes, that's right. Does anyone want to briefly address Mary Lou's concerns before we vote on this motion?
And I'm sorry, Chair, did Charlie's motion have a second? I apologize.
Oh, yeah, maybe not. Does anyone-
Well, so it was
Do you
Jeff's
need it or
motion,
just need to? Yeah.
and he accepted it, and so I will second his
Oh,
motion with
okay.
the
Oh,
All
acceptance.
right,
So
got
yes.
it. Great. Yeah, got to keep track of these things. Thank you. All right. Any other comments before we vote? Okay, let's do a roll call vote.
Cheryl Ramirez,
Yes.
Chunwei Chi,
Yes.
Mary Lou Henrich,
No.
Richard Gibson,
No.
Jeff Goodman,
Yes.
John Santa,
John?
John Santa. Are you?
You're on mute.
I'm sorry. Yes.
Thank you. Bethany Sears is absent, and Charlie Swanson.
Yes.
Okay, that's 5-2.
5-2. Okay, interesting. All right.
And just to confirm, to Charlie and the group of what we just voted on, we voted to say we are recommending to the governance committee a 3-month reserve target of operating expenses and some kind of trigger, a trigger at 1 month, which will trigger something which we have not yet identified.
Yes, thank
Okay.
you for restating that motion and what we agreed to. Okay, thanks so much, everybody. Okay, do we have anything else on reserve funding and financing, Morgan?
No, Jeff
Yeah.
cut right to the heart here. So
Okay, now I'm going to offer a motion that says for the reasons that we have talked about the
Jeff, Chenwei's got his hand up real quick.
Oh,
Maybe before we go to the motion. Yeah,
fine.
sorry. Yeah,
Please.
Yes, one thing we may want to make recommendation is when this universal health plan is implemented, we will need initial endowment or investment from the state because we would not have reserve.
yeah, that's one of the key pieces in the memo is having some lifeline from the state initially. So go ahead, Charlie.
I mean, I essentially agree with Chunwei, but I would expect that it would be almost impossible for us to get just a handout from the state. I would guess it's going to be a loan from the state or a loan of some manner that has to be paid back with future revenue from the plan. So I mean, yes, we're going to need something, but I can't imagine how we're going to get it beforehand.
Yeah, this is there will be kind of a key financing arrangement that'll have to happen with respect to how does this get some startup, and this is also tied just with the not just with the transition, basically, how do you sort of move from the current system to the future system and pay for any big administration or IT with existing versus new needs. So,
And speaking to that
important
point, I believe that one of our guiding principles said that we should not tap into general funds. So it just makes Charlie's comment even more challenging. But now I have one more motion on the reserve report.
Okay, go ahead.
Because there are a number of problems, challenges with this reserve report, some of which we have talked about today, others we have talked about previously. I offer a motion that we do not accept or we do not approve of the reserve report as presently prepared to be submitted to the governance committee.
Okay, do we have a second on Jeff's motion?
Second.
John seconds. Any discussion?
I'll offer one last comment on that. The reserve, I mean, I appreciate the laundry list of items. I appreciate that we have now taken a vote on what the reserves should be. That's what a Finance and Revenue Committee should do. But if I was a financial officer at a company submitting this report to a board, I would be concerned about my job the next day. It is not yet ready and is acknowledged in the draft that it is not yet ready. So I think we need to be very explicit about, we acknowledge it is not ready, but you're going to take it as it is submitted.
Charlie?
What happens if is an abstention just not counted one way or the other, I guess? And so if it does not, it needs to receive a majority for this motion to pass.
Yes.
Okay, so I'm going to argue that, to me, again, this is a report from Echo Northwest. And it is not, and I don't think it's even, this one I don't even think is couched as a report from our committee, but I would have to look at it more carefully to know that. And I don't think we've had time to say yay or nay one way or the other, and so I'm gonna abstain.
I would agree with you, Charlie, and Morgan said at the top that this isn't finished and that the work needs to move to the transitions committee. So he did say that at the beginning. Richard?
I think this is the first bounce on reserves. I learned a lot from it. I think other people that read it will learn a lot from it. I think the only thing I'd ask is the revisions that have been suggested to remove comments about other people's money. But other than that, I think that it's a reasonable report to move forward because it's the first bounce, not the final word. Thank you.
Thanks, Richard. Any other comments before we vote? Jeff, could you do me a favor and restate your motion just to be really clear?
Certainly.
Thank you.
I move that the report as prepared be acknowledged as not ready for prime time. I lack better words. But we do not support the, let me try again. We do not support this report as presently written.
Okay, thank you. So
including the motion that we just passed earlier, that's going to go into this report.
okay.
The 3 month and the 1 month, that needs to be included in this report now.
And I assume, Morgan, that's what you will do. I mean,
Oh yeah, I'll update, and I'll just say this was not a product that was going to the board to begin with, right? This is a working draft going to transition for further work. So.
Mhm. Okay, with that, any further discussion before we call for a vote? Mary Lou.
Well, with those discussions and clarifications, I'm really confused about, maybe I've just got a hazy morning here, but I think I will abstain too, because I'm just not quite sure what all of this means. I didn't think the report was getting ready for prime time. So anyway, that's, I think, what I'm going to do.
Okay, thanks, Mary Lou. Okay, with that, can we call a vote?
Yes. Cheryl Ramirez,
No.
Chenwei Chi,
Abstain.
Mary Lou Henrich,
Abstain.
Richard Gibson,
No,
Jeff Goodman,
Yes.
John Santa,
Yes.
Bethany Stairs is absent, Charlie Swanson.
Abstain.
Okay, so that's 3 abstentions, 2 noes, and 2 yeses.
It
Yeah, I'm
fails.
not sure what to do about that, honestly. Can I call him
So-
parliamentarian?
I think it fails.
fails.
It fails. It fails, I think, for 2 reasons. One, since it's a tie, it fails. You have to have a majority.
Okay.
And also, I would say you actually have to have a majority of the committee members and an abstention. But I'm not sure of that part. But whatever, it fails.
It ties. so
Okay,
it fails.
all right. Thank you for helping me out. Okay. So, let's see, it's 10:30. Do you want to take a break or do you want to get into the revenue proposal revisions?
Take a break.
Okay, let's take a 10-minute break and we'll move forward with the proposal revisions. Thanks. Okay, I'm going to call us back. And we're going to get started with revenue proposal revisions. We have 2 on the table, one related to household size rate readjustment and one on Medicare Part B premiums. I know that Morgan and Charlie are tag teaming this agenda item, so I'll let you 2 take it however you want to do that.
Well, I don't know much tag teaming. I think this is I can be of assistance, but I think Charlie has put together some materials and sent it out. I think I'll turn it over to Charlie to mostly just to walk us through both. I would probably start with the household size rate adjustment factor piece, and then provide any comment here to support or
Okay.
happy to be helpful in
All right.
supporting that
Good
conversation.
backup.
I think this is a Charlie thing.
Okay, sure. Take it away, Charlie.
Yeah. So hopefully people had a chance to look at the reasoning for why there's. I am recommending scrapping the household size rate readjustment. The impetus reasoning was that it is part of a part of the tax policy that we proposed that increases the financial incentive to file separately rather than jointly, or rather than with a large number of exemptions. It ends up being better financially to split up. The other reason is that it greatly simplifies the tax structure to not have it. It does require more. It means there's a loss of the revenue and it has to be made up somewhere. And I appreciate the public comments today. This is not part of the proposal, but I think that the transition committee should be considering, especially, I think, a tiered EPT so that very large employers and public employers pay a higher rate than the 9.6% that we proposed. And I think we can readily make up the amount of revenue lost by not having the household size rate readjustment, by doing that in a way that is not going to hurt businesses that pay. I don't think it's going to cause many businesses to have to pay more than they're currently paying. I think most will still pay less if we keep it to large businesses. But I think that's a separate question. Right now, I just want to say that we should get rid of it, the household size rate readjustment, for simplification purposes and to decrease the incentive to file separately. I'll stop there.
Charlie, are you presenting this as a motion at this point, or do you want to still just talk about it a little bit more?
No, well, I'm. It's a motion. Yeah,
Okay.
we should vote on it. Yes.
Okay, so
It needs a second to be able to talk about it. So
yeah, so Charlie's made the motion to, I don't know if we can use different words, but scrap HSRR. So Maybe you can think of another verb. I don't know. Who would anyone like to second? Charlie?
I'll second.
Mary Lou seconds. Now we'll have discussion. Does anyone have any discussion?
This is Mary Lou, I strongly, for the reasons that Charlie lays out, think that we should not have this be part of our tax proposal. However, I also have the concern that Linda Krieger and others have brought up about simply saying, oh, it's just another $1 billion. Let's just add it on to the personal income tax. And, just all these pieces that, you're taking and moving and upping and downing, et cetera, because you philosophically mean, to do good over here. So I do like the fact that Charlie brought up the idea of, because I've felt all along that the EPT, for some large businesses as well as large public entities, will be really saving a lot of money by not having to pay the premiums they're paying for their employees. And so somehow to get more out of those larger employers makes sense to me. So, but I know that, we've got these other proposals. So it's like, I'm not sure, I think at this point, it's simply in my mind, a recommendation to the transition committee to explore this further and the financing piece. So, but overall, I'm supportive of the concept.
Thank you, Mary Lou. I just have a follow-up question for Charlie. I was thinking that was a separate issue that you were just discussing right now, but is the household size rate readjustment affecting how much the large employers pay in EPT? Because I'm confused.
It is a separate issue. The household size rate readjustment, getting rid of it is going to mean our current proposal provides less revenue. And we already have a lot of uncertainty in how much revenue is necessary, but we can be pretty sure that we're going to need to raise revenue from somewhere else if we get rid of it. One of the possibilities is what I suggested, and I would agree with Mary Lou that at this point, it's essentially a suggestion. It's a informal suggestion for the transition committee to think about it. But the formal suggestion is, let's get rid of the HSRR.
Okay, thanks, Charlie. John has his hand up.
Yeah, I'm a no on this. I'm a no really because I agree with some of the comments Mary Lou made. This is not the time. This committee is at its end. It's not the time to be adding $1 billion in additional taxes. And there are alternatives. Charlie mentioned one. I mean, if this was part of a package that if we made some changes over here on the employer side, then that would fund, if you will, the change in the household size. And there would be no net a change in taxes. In the real world, of course, you'd have someone at the table saying, well, now, wait a minute. If we're going to balance our budget, we're going to have to get rid of the dental benefit, or half the dental benefit, or all of the vision benefit, or we're going to have to lay off a third of the staff of a single payer. We talk about alignment, and this is an example of we're not there. This isn't aligning anything. And so, colleagues, the motion to make here is this should be referred on to the transitions committee as something for them to address. So if I'm understanding the motion, which was to approve this, I'm a no.
Thanks, John. Richard?
I'm a no on this. These are tough trade-offs we have to make. The simplification doesn't take me very far taxes are complicated. Putting another $1 billion and shifting costs from bigger families to smaller household units doesn't make sense. I think there are other ways to address the incentives to file in smaller household units. Tough trade-offs. I'm a no. Thank you.
Thanks, Richard. Chenwei.
Yes, I also concur with Mary Lou and John as well. Again, this is not a time for us to add additional tax to already estimated quite high. Predicted the current prediction is already very high. Also, again, I also support to let the transition committee to make that decision. And I just want to quickly share Taiwan's example. In Taiwan, it's a flat rate for the payroll tax that divided between employer and employee. And given its flat rate, but Taiwan has a household multipliers. They set the limit to up to 3. So if you have more than 3 additional household, beyond 3, you no longer add additional tax. And so, for example, if the payroll tax is $40 per person, and then this person has 3 dependent household, then this person will pay $40 multiplied by 4, plus including the person herself. But if the person's tax liability is $300 per month, again, for the same 3 additional dependent, this person, not just this person, but together with the employer, will pay $300 multiplied by 4. So that has built in some level of progressivities, people with higher earning, and that compounded by the size of household. And so my concern is by removing that, we are adding additional tax. At the time, we don't know where we can get additional tax.
Thanks, Chenwei. Charlie?
So I will argue that we're already just making recommendations to the transition committee, essentially. I mean, we've kind of made recommendations to the board, which is essentially going to be a recommendation to the transition committee to continue consider it. And my feeling is that we should recommend something slightly different than what we've recommended. And that I guess it doesn't make sense to me to say what there is, if we did get it from the HCPIT increase, which we might not decide to do that. We're not getting more taxes. We're getting the same amount. I mean, that's the whole thing. It's the same amount. We're getting it from different places, where the places where money is being saved by getting rid of it is the middle to higher income, larger families would pay a little bit less if we get rid of it. The very top income, most of the change is that the highest AGI level would pay a little bit more if we get rid of the household size rate readjustment. And that's because the tax rate would go up a little bit, and the fact that they're not having to pay for extra people a little bit more, or a tiny bit more, in fact, for us people, is way dwarfed by the slightly higher, the 1% higher income tax there. So it's the same amount of money. It's coming from different places. If we did it purely with HCPIT changes, it's the same amount of money. It's just coming from different places, and where mostly from the higher income people are going to pay more if we get rid of it. So let's stop there.
Thanks, Charlie. Jeff?
I agree with Charlie that if we reduce the tax on one category and increasing it elsewhere on a static basis, there is no net change. But we should also, if we're going to recommend this change, we should make a statement that we are in favor of increasing taxes elsewhere or reducing coverage expenses as another alternative. And we can, raise the healthcare personal income tax. That would make up the difference from lowering the other tax. Or what did we choose to cover can also be a source of making up that revenue. And we as a committee should make a recommendation on that, whether we're going to go for leaving the total taxes the same or changing the expenses. And Charlie, I mean, I don't know, where's your thinking on that? I mean, would you go for more taxes on one item, or would you go for reducing coverage?
I would go for more taxes. Yeah, I mean,
Okay.
so I would, if you wanted to make an amendment, if it's a second amendment, if it's been proposed and seconded, I mean, I could make amendment that we say we want to get rid of it, and we recommend that taxes be increased somewhere to make up for that, and not specify where they are. I mean, that would be fine with me, because at this point I would say I don't want to specify whether or not it's HCPIT increase or a EPT tier. I would say just make it up in taxes somewhere.
Jeff,
I think that's an important. I would certainly support adding that into the motion.
okay, you're
Okay.
asking for that amendment. Okay. And Charlie, you're okay with that?
I'm okay with that being in front of the amendment, yes.
Okay. So with that, I think we're ready to vote. So could we do a roll call vote? Oh, wait, let me just, I didn't say anything. I wanted to say one thing. I totally understand your rationale, Charlie. And at the same time, I'm very concerned about the political viability of that proposal right now. And I was listening really closely to the public comment as well. And I'd feel more comfortable just letting transitions committee talk about it, discuss further, and maybe there will be a nuanced
I
proposal.
will point out that the public comments were mostly that they agreed that we should get rid of it. So
I thought they were saying they were concerned about the $1 billion increase. I don't know.
I think they said both, that we should get rid of it and we should be concerned about that. That's my understanding.
Okay, Mary Lou.
I guess back to this question of, is this a recommendation, a vote to take this to the board? Or is this a vote to pass it on to the transition committee?
It's a vote, in my mind, it's a vote to change our report that we're going to vote on soon, to not include the HSRR. I think, we had that 4-pager that Equitable Northwest put together, and essentially this is a vote to change that, to not say anything about it. Maybe it doesn't even say anything about it now. I don't remember now.
I don't think it does.
If it doesn't, then we don't necessarily need to say that, I guess. But it would be that in the larger Echo Northwest report that we would not include the section on the HSRR. So that's how this vote would affect what we're reporting.
Okay, thank you.
Thanks for clarifying that. And like any of the other recommendations, even if the board doesn't vote to approve our recommendations, we will still be presenting our recommendations to the board, even if they go, if it goes to the transitions committee. Okay, so are we ready to vote? Okay, let's do a roll call vote.
Okay, Cheryl Ramirez,
No.
Chenwei Chi,
No.
Mary Lou Henrich,
No.
Richard Gibson,
No.
Jeff Goodman,
No.
John Santa,
No.
Bethany Steers is absent, Charlie Swanson.
Yes.
So that fails.
Charlie, welcome to the Jeff Goodman Club.
Thank you. Yeah.
Yeah. Thank you for bringing this forward, though. It was really, really important discussion. Appreciate it. So let's go on to your next proposal for Medicare Part B credits or premiums.
Okay, so the Medicare Part B, to me, it's similar in that we're gonna have to raise taxes if we decide to cover Medicare Part B. And this one is actually an increase in taxes. The other one was not. It was just a redistribution of where the taxes is coming from. But in order to cover Medicare Part B, it's going to, I mean, nominally, it's going to require an increase in taxes somewhere. But what we have not yet calculated and what would affect this much more greatly is if we do not do this, what's the, this kind of goes like a Jeff Goodman effect. What's going to happen if we decide not to cover all Medicare Part B, and there are people who are currently paying that, there are tax filers in Oregon who are currently paying that and say, oh, I'm not going to pay that. I don't plan to move out of Oregon for the rest of my life. I'm going to stay here. I'm just going to be covered by the Oregon plan and not worry about Medicare being, covered by Medicare, because the Oregon plan is going to cover everything anyway. And so I'm not going to pay my Part B premiums. And they're a resident of Oregon, and they're going to say, I'm a resident of Oregon. You got to cover me. I'm not going to apply for Medicare. Why do I have to do that since I'm going to be covered anyway? And so then the plan is going to lose all of the money that Medicare might have sent to the state to pay for their health care. And on average, the loss in Medicare money is about $8,000 a person. And this is 2022 dollars. It could be a lot more later, but the Part B premiums will also go up. But the Part B premium for that person is only about $2,000. And so essentially we are saying, oh, we're not going to pay that $2,000 for that person. And they're going to say, oh, I'm not going to pay the $2,000 either. And so we're out $8,000. So to me, yeah, this is going to increase taxes, sort of. But if we did a better analysis, we'd say, no, it's going to, if we do not do this, it's going to increase the tax rate we have to have. So, and it's going to be really hard to figure out how many people are going to make that decision. So we'll have a huge uncertainty in our financial planning. Maybe we already have so many uncertainties, but it will increase it. And so I don't see how the plan can survive if we do not cover Medicare Part B. So,
Charlie, would you like to make a motion?
yeah, I move that we recommend to the so we recommend putting in, I think this one actually is in the small report, but also in the larger Echo Northwest report, that the plan should cover Medicare Part B for all those who could be eligible for Medicare if Medicare Part B premiums were paid.
Okay. Do we have a second?
Second.
Okay. It's been moved and seconded. Now we're on to discussion. Looks like Chenwei has his hand up.
I have a question whether we need to make an amendment. The issue is whether the universal health plan will get a waiver from Medicare and condition on we receive all the Medicare revenue that are supposedly to cover the Medicare recipient. And I think that this point might be an important condition whether we cover Part B, because if we do not get the waiver, we do not get the revenue, then that will be an issue. That given if we do not receive those waiver and revenue, and we are still covering Part B, that will be extra burden.
Good
So-
point, Chenwei. Do you accept that amendment, Charlie? Go
Yeah.
ahead.
I would say that everything we're planning is conditioned on, will we continue to get the federal money in some manner? I maybe not a waiver. There's other ways. I would say there's probably better ways than a waiver for Medicare. I don't think there is a waiver you can do for Medicare unless the state-based universal health plan, Healthcare Act is passed. So that probably a more likely way is for the state to become a Medicare Part, a Medicare Advantage insurer. But this is we would only pay Part B if indeed we were going forward with a plan that covers Medicare patients who are getting the Medicare premium or the Medicare Part B money from the federal government. So I think that's a given that we wouldn't, I mean, there's all sorts of caveats if we don't get federal money, what we can do. And I would say pretty much nothing. So.
In that case, should we just add that language?
I'm okay with adding it, I guess, for the motion that says, we'll pay the Part B premium if we get federal Medicare Part B money.
Yeah, that's just to clarify. I think that sounds good. Thanks, Charlie. Jeff?
It's very clear, no waiver, no program. But, and Charlie, I'm guessing also in this case that the loss of revenue if we adopt this proposal would then come from increased taxes elsewhere, as opposed to reducing expenses.
Yes.
Okay, I was pretty sure that's what you thought, but I wanted just to clarify.
Yeah.
Thank you.
Charlie, I have a question for you, concerning the point you made that if people didn't think they would have to pay their Part B premiums, what if we had a legislative fix that would compel them to pay Part B premiums?
Well, I mean, suppose they didn't, what would we do? Would we say they are not eligible for the plan and we won't cover them at all? I mean, that's a possibility. So I would say we don't want to do that, but that, for a couple of reasons. One is, I don't think that it's going to be relatively lower income people for which that would be a reasonable financial choice to say, I'm just not gonna pay it, and I'm gonna be covered anyway. And then we'd say, no, you're not covered, you're not paying it. I'm not sure what we do if they don't pay it. And then another thing is, if they decide not to pay it and for some reason they later leave Oregon, then they have penalties for not paying it. And these are lower information, to a large extent, they may well be lower information voters and people who will make a choice at the time that will hurt them in the future, and we don't want to encourage that sort of choice.
Okay, thanks, Charlie. I thought you had your hand up, John. Did you? Maybe I got that wrong.
No, I did. I meant to.
Okay, go ahead, John.
I would put this in the same category as the previous household discussion. A very interesting idea, but from an administrative point of view, it raises a number of issues. From an expense point of view, it raises a number of issues. I mean, at its heart, to some degree, is, well, would Oregonians be in favor of paying Part B premiums for someone who then, won't participate in the plan? I think Charlie acknowledged that this is something that deserves analysis. So why doesn't do an analysis? And the Transitions Committee can do at least some sort of analysis around the basis of this, and including hopefully some input from legislative revenue and the tax folks, and and all. So again, an interesting idea. It's just too late in our process for interesting ideas.
So I've done some analysis and I sent it out to people that could look at it. So I'll just stop there.
And I just want to say, similar to John, I want to be consistent with my other vote that I'm concerned about political viability right now. And I think this deserves more consideration by the Transitions Committee. So with that, go ahead, Charlie.
Yeah, I mean, I would say that Medicare people tend to vote, and if we don't do this, I would say we have no political viability. So anyway, I would say that political viability argues the other direction.
Okay, thanks, Charlie. Okay, so with that, let's call a vote on this proposal.
Okay, Cheryl Ramirez,
No.
Chun-Wei Chi,
Abstain.
Mary Lou Henrich,
Yes.
Richard Gibson,
Yes.
Jeff Goodman,
No.
John Santa,
No.
Bethany Steers is absent, Charlie Swanson,
Yes.
Okay, so that's tied, so I think that fails.
So it fails, yeah.
Thanks again for bringing up this issue. It's really important. And I hope you all in Transitions Committee, the three of you here, talk about it again. Okay. All right. Thank you so much for those proposal revisions. And I just want to check in with Morgan. Is there anything you want to add at all to this discussion before we go to the basic revenue proposal?
Yep, I'm good.
You're good. Okay. All right. So we'll toss it to you. Oh, Jeff, do you have something?
Yes, before we go to the basic revenue proposal, Charlie, were you able to get those two breakpoint, I call them breakpoint, numbers for a single person just filing for themselves, where the decrease or increase in taxes would occur, and whether a married couple with 2 children, where the decrease or increase would occur?
You're on mute,
You're on
Charlie.
mute.
I will put in the chat what I have been able to put together while listening to this meeting, and I will share with Jeff. So basically, I did that for some of the single filers, and I think one or so of the 2 exemption filers, I didn't get a chance to get to the 4 exemption filers. I might add to it later if I get to it in while I'm trying to listen to other things. So
Thanks, Charlie.
My sense of it, and again, please correct me if I'm mistaken. My sense of it is that if you're a single filer, just you, the check breakpoint's about 80,000. And if you are married filing joint with 2 children, it's about 180,000. Give or take on,
that's somewhat close to reasonable. Well, I would say the caveat is it depends on whether you're employed by a large company or not, and if you are, and so it's real. The breakpoint for an employee of a large company is about 60,000 for single filer. For somebody who is not getting any Social Security and also not employed by a large company, the breakpoint is more like about 95,000, I think it is. And this is again comparing to status quo, and that's if they actually purchase insurance in the status quo. If they don't purchase insurance in the status quo, the breakpoint is way lower than that because they're not purchasing any insurance now and they'd have to pay a little bit of taxes. I haven't figured that out. So, but I did send, I think posted on the website is this sort of analysis in a spreadsheet for a variety of different filers, including 1, 2, 3, and 4 exemption, and those with Social Security and those without, and those with, from a large company that is going to have to pay a little bit of EPT, and those are filing on their own. And in general, it increases the more exemptions you have, the breakpoint increases. And if you are self-employed, the breakpoint also increases if you had purchased in the status quo. So,
yeah. And I mean, I agree that the employment, I mean, it's a complex question, and I don't mean to imply that it's not, it's a simple answer, but that your employment status matters, but that a single person, we're looking at, as you said, 60 to 95. And I would venture that if it's a married couple with 2 children, we're probably looking with somewhere between, and again, subject to employment status, we're looking between 150 to 200,000. It would be a range.
Yeah. That's probably right. Yes.
Thank you for that extra work on the fly, Charlie. Let's move to the revenue proposal. And that's Mimi, I believe.
All right, thanks everyone. So the revenue proposal was proposal summary, to be clear, is a very truncated 4-page document that you received. It was put together with information from the Echo Northwest report and then also with input from committee members as well. So I'm just going to go over the slide deck, which has different parts of the proposal, and then you all can decide what you want to do with that information, whether you want to make a motion or whatnot. So what I wanted to put out in the first part is that this proposal summary just is here to provide a high-level summary for a base level of understanding of the revenue plan for board members and for members of the public. So that was the impetus behind this. Dollar amounts and percentages are expected to change. And this demonstrates the revenue plan that was developed by this committee in relation to that revenue replacement target created from the 2022 data. The CBIZ Optimus modeling report was used as a basis for estimating the expenditures. As mentioned, tax year 2022 was used as an analytical baseline, and that revenue replacement target was $16.9 billion used as the reference point. All right, here we have the revenue instruments as put forth. Oh, Charlie, please go ahead.
Can we go back to the previous slide?
Absolutely.
So, I mean, that's not really correct. The first statement that we used, Optimus report as a basis for estimating expenditures and revenue needs. We actually recalculated the status quo expenditures and compared them with what a interpolation of what Optimus said between 2019 and 2026 as sort of a check, but all of the status quo expenditures were recalculated. We did then use Optimus values for estimating the savings and extra costs that would occur compared to the status quo if we changed to a universal health plan. So Optimus numbers for all of that change in status quo expenditures was used. And then we went forward and said the revenue needs are going to be what's going to change from the current way it's being paid for to taxes, basically. So that, and what I used basically as a estimate of that was what's being paid in private insurance premiums and out-of-pocket costs, minus some of the out-of-pocket costs that are no longer going to be, that would not be covered, which includes out-of-pocket for long-term care and some other out-of-pocket that the plan probably wouldn't be covering. That was then used as a revenue target. So it's a little bit more complicated than
Absolutely.
we did not use, in fact, an estimate of expenditures from Optimus. We made that estimate on our own. So.
Okay, so I think that certainly that will be either completely, that line would be taken out, and perhaps you'd be able to create something similar to that. And
I actually did submit some comments to Morgan, I think that related to how I would suggest changing the wording for that part. So
I got
yeah.
that.
Thanks.
It took me a while to figure. I didn't realize that the 4-pager. I didn't. I don't get the material, so I thought Charlie's comments were about the report and not about the 4-pager. So
Well, the first ones I sent you were about the longer report, and then the second ones I sent you were about the 4-pager.
Yeah, I'll forward those to Mimi.
Okay.
Yeah.
Right,
Thank you. Okay, and again, this is all, this is just as a starting point, and appreciate all of the comments. Yes, Jeff.
Yeah, I agree with Charlie. We are conflating a revenue increase with an expense reduction, and we should make that clear.
Thank you. Absolutely. Thank you. All right. And now the table, which is taken from the Echo Northwest report. I think people are familiar with this, talking about the instrument, current Oregon rate, additional increase. This is, of course, as mentioned in 2022 dollars, the estimated revenue and the percentage of total. Again, lots of caveats. This is subject to change. Is there any, I'll go over, each one of these is going to go, we'll go over in just a little bit of detail. So the corporate income tax add-on to ensure that profitable corporations contribute directly to financing the universal health plan. There's a corporate activity tax add-on to broaden the business participation, provide a steadier business-based revenue stream. Now, getting onto the other instruments, the employer payroll tax, the healthcare personal income tax, and then the lodging tax add-on. Now, this is where the employer payroll tax tax credit is mentioned here, and Medicare Part B premium credit at this juncture would remain. Although certainly, again, this would just be information provided to the board as a baseline, subject to change. And here are the details on those proposed tax credits. All right, so it's like I said, it's very basic. You'll notice even that the household size rate readjustment is not mentioned in there, but I believe from the table and the percentages, the numbers from that have the household size rate readjustment included in it. So I'll just open it up to discussion. Cheryl.
I first wanted to make a motion that we accept this basic revenue proposal, that we move this forward as a recommendation. So just to get things started here. Do we have a second?
Second.
Okay, thanks, Richard. So now we'll have discussion. It looks like Mary Lou has her hand raised.
Well, my question is, isn't this simply a compilation of all the other pieces that we have made recommendations and sent forward? Is there anything different or new in this proposal?
No, there's not. It was just to understanding that this committee might make some changes to the proposal before it went to the board. So the board has requested that they have kind of a like you said, sort of a condensed version of the basic implement. So you're correct. There's no substantive changes at all.
Okay, thank you.
Chenwei.
When when the committee make recommendation, can we add a language specifying that this projected tax requirement was based on an estimated costs or projected costs, largely based on status quo, not taking into consideration significant administrative cost saving, not taking into consideration, again, there's a whole range, but we can just simplify the language. What a single-payer universal health plan is capable of cost saving. And that requires further estimation. Otherwise, it will be problematic to propose such a high tax rate. And I think we can simplify the language, particularly given that we are based on the status quo, not taking into full account of what a single-payer universal healthcare system is capable of. There's a whole list of things we can discuss in the board.
Thanks, that's a really good addition. Richard?
As I look at this 4-page summary, in my mind, I'm thinking that the spreadsheet behind it includes the household size rate readjustment and includes a non-refundable Medicare Part B credit. Now, I'm not sure we need to state that in this document because it doesn't address it in this document, but does this document make a case on either one of those or over?
Did you want to answer that, Mimi?
Any verbiage you would like to have added certainly can be added or
Oh, I don't think anything needs to be added.
Okay, but
in my mind, I'm thinking make the
clarification.
numbers come out. That's what we decided. But
Yes. yes, I think that is I think that that clarification could easily be put in there. Thank
Footnote.
Thank you. John?
I'm sorry, Mary Lou, what?
I said a footnote. I mean, I
Oh,
don't know,
footnote, thank you.
an
Okay, got it.
asterisk or something,
Okay, thank you. Yes.
Yeah.
Thank you. John?
Yeah, well, you know, I think I'm headed towards a no. And the reasons are in large part have to do with what Chunwei just articulated. I never imagined that this process wouldn't involve alignment, wouldn't involve a process where that $17 billion of new taxes scared the hell out of other folks involved in this. And we all sat around at a table and agreed on something a lot more reasonable. My own feeling was that it would have been easy to accomplish administrative savings at the payer and the delivery system such that the total tax revenue here would have been $10 billion or less. There was no attempt to do that. Instead, the board, without really any significant discussion or analysis, agreed on an 8% administrative savings. You know, I'm left with, again, a last meeting where I only have one chance to emphasize what an opportunity was missed, and how important it is that the highest priority be that that opportunity be pursued. Now, I guess I'd have to hear an amendment of some sort along the lines that Chunwei suggested, that would allow me to be a yes, but that's where I'm at.
Thanks, John. Here's what I wrote down, see what you'll think. So the motion is to recommend the basic revenue proposal based on the status quo, not taking into consideration cost savings expected with a universal health plan. Does that cover it?
It's not emphatic enough for me.
So I'm gonna hopefully chime in here. What Chunwei proposed is completely wrong. It did take into account a lot of that, maybe not enough. And what John said, maybe not enough. But I will say what we took into account was what Optimus took into account. And we also said we're going to actually increase the provider office savings to 8% from the 4%, acknowledging that some people think we could get as much as 12% savings, but also acknowledging that one of the things the task force said is we're going to take a little bit of that potential administrative savings and use it to provide more mental health care and more behavioral health care and more primary care. And so we did take into account, I guess I should say, what Optimus took into account, because that's the only information we had at the time when we were making the first revenue things. So we took into account provider office savings of 8%, not just 4%. We took into account savings that Optimus said you would have in the payer side because of no insurer overhead and some no insurer advertising costs. We took into account increases in expenditure that Optimus said we would have because we're going to be covering more people. We're going to be covering them with better care. So all of the things that Optimus took into account were used as the numbers that Optimus provided. Actually is interpolated from 2019 to 2026. So that was the information we had at the time. One of the things that I was hoping we would do in this committee, which John correctly acknowledges we mentioned that we did not do at all, is are there changes that we would like to make from what Optimus said we would have in those savings and added expenditures? So I would say I'm dead set against this motion that Chunwei made because it's completely not true.
So how would you change the motion, just so I'm clear?
I would just vote against it because it's just not true.
Okay, all right, Jeff?
Are we talking about the main motion or Chun-Wei's motion?
I was talking about Chun-Wei's motion.
Okay, my comments are about the main motion, so I'll pass for now. I mean, I want to talk about when we get to the point of voting it up or down.
Right. I'm just trying to make sure we have an accurate motion
Yeah.
to support the basic revenue proposal, and I'm open to changes, clarification. So let me call on Chen-Wei.
Yes, what I was saying in terms of this motion was not the current plan totally ignore potential saving. What I was saying was it did not adequately address. And this is an issue of lack of understanding and lack of imagination what a single payer universal healthcare system is capable of, way beyond administrative costs. It has the monopoly power, the leverage. For just one example, prescription drugs, that a single payer universal healthcare system is capable of significantly reduce the annual expenditure of prescription drugs. Likewise, it can significantly reduce the unnecessary diagnostic imaging, unnecessary precision, unnecessary lab tests. Likewise, it can negotiate the payment system that the universal health plan should capture what we save on the administrative costs from the provider side, particularly hospitals and clinics. How much we save them should be accounted for how much we pay for them. And so these are just a whole list of examples what a single payer universal healthcare system is capable of. And I'm concerned that the current estimation did not fully cover that. That's my motion.
Thanks.
We need further estimation of what a single payer universal healthcare system is capable of saving beyond the administrative cost.
Okay. Thanks, Chen-Wei, for clarifying. John?
Yeah, well, when I listened to Chun-Wei's comments he just made, I totally agree. I totally agree with his comments. I'm not sure his amendment captures that, but you know, I think it's been underestimated how powerful the single payer can be when it comes to costs. Charlie, when I was on the task force, actually, I was in of the group, you know, and we were in the minority that wanted 4% admin. Optimus pretty much insisted on 6%, and the majority went with Optimus. I was in the minority that listened closely to Bill Shao, the former CMS actuary, who said, you will never be able to get a tax passed if you don't have at least 16% administrative savings on the delivery side. I was in the minority on that. And part of my thinking was, as we come down to the last meeting, I'm probably going to be on the minority on this one, but you know, I'm going to speak up to that, because what makes the single payer idea transformational is those savings. Because if you don't get those savings, then you're going to take it from benefits, or you're going to do cost sharing, and I don't want that. You know, the battle needs to be fought right here, and it hasn't been fought sufficiently. So I'm doing my best. So if everybody understands that that's what Chun-Wei's amendment means, then maybe that's workable. But I guess we'd have to attach a audio tape of what he just said. Thanks.
Thanks, John. How about this? Recommend the basic revenue proposal based on status quo maybe not status quo, but not adequately addressing cost savings expected with the UHP. Instead of saying not at all addressing, I don't know. So Charlie, go ahead. Maybe we'll keep thinking.
I mean, I just want to add that among the cost savings that was addressed, again, using Optimus numbers, and so perhaps that was not adequate, is the monopsony power for drug purchasing. So there was a decrease in costs because of that. I would also say that we have other entities arguing that we have not adequately addressed the extra costs that are going to occur. Essentially, all of Milliman's report would say we haven't come close to addressing the extra costs, which I would disagree with. But there's going to be, I think we can acknowledge that there's going to be a fight between, can we get a whole lot more savings, or is it going to cost a whole lot more extra? And at this point, I would say that Optimus was about where I would land on it, unless I hear something strongly otherwise. So I'm going to be a no on anything related to other than just we should or if it was just a recommendation that there should be a strong effort to address possible savings in a single payer plan that has not been adequately addressed so far. If it's like that, I can go for it, otherwise not.
Okay, Mary Lou.
I don't know. I'm having trouble this morning, kind of having my idea and then listening to somebody else and then kind of losing my idea here. So I really do agree with various, sides on this issue that the numbers as put forth, Charlie did take with what was known with Optimus, what, people, the various inputs. Does it have enough of those savings in it? I don't think it does. So I think I agree with Chunwei. I agree, that there are a lot more savings. One of the things that I think comes to mind is that all of those thinking that went into Optimus and into the task force, were several years ago. Life has changed dramatically in the last few years in terms of AI and other technology and the adaptation of many and most large and even smaller healthcare systems and providers moving to a single platform with Epic software. That is also, as I understand from talking to their CEO, undergoing major transition that will save innumerable amount of money at the provider end and probably at the plan end. And so I think that hasn't been thought through. And I would think that's something the transition committee will be taking a look at is what additional savings can we have from IT and from AI that was not even, I don't think, in the rearview mirror when this was discussed. So I'm not sure if that helps or hinders, but I just felt I would say it.
Yeah, that's a whole new frontier for sure. I attempted to do another iteration of the motion. If anyone has any suggestions, I'm open to more language revisions. Jeff?
Well, I'm going to channel my King Henry V from the Shakespeare play, Henry V. Once more unto the breach, dear friends, once more. One of the items that we requested very early on as a committee was a statement of revenue and expense projecting going forward and before and after. We don't have that. That is a fundamental flaw in what we're sending forward. And the motion, the motion's okay, but it is just another example of why I think we all wanted this committee to continue, because we are punting. And while I value and appreciate the competence of the people on the transition committee, all good people, collectively, they have less experience than what we have on financial matters. So while I hope they will address these questions in a substantive way, I am not hopeful that they will have done it as well as we would have. So
Thanks, Jeff. Any other comments or changes to the motion? Again, I'm open to suggestions.
a question, is this the final vote that we're going to have as a committee today?
Yes, that's as far as I know.
Okay.
Things
Then,
can happen, but
right.
that's
So
the only one that I'm planning.
So, okay, thank you. So I want to express the substantive concerns that I have with where we are. And it's, we're bringing forward a proposal, I'm speaking collectively, where we're going to make a proposal where we don't have a full picture of all the costs. They still haven't been added up. Let me go over my six major concerns with the report as we currently are. Number one, we are ignoring a majority of our own adopted principles, and we have not accomplished the deliverables that we were asked to do. Number two, we do not have an income statement projection and a before and after for what this is going to look like. I can tell you that having served on a number of committees where people are coming to look for funding for companies, if they were to present their ideas without an income statement, they would be politely told, guess again. Number three, we have revenues that are overstated. We know they're overstated because of not having the dynamic impact. We know we have expenses which are understated because we've said or have been told that the total number of doctors and medical practitioners will not go up in total between now and 8 or 10 years from now, but we want to increase the number of general practitioners and the number of nurse practitioners. Basic math says, if you're going to do that, you must reduce people elsewhere. That's specialists and admin. We have assertions, but we have no analysis. Number five, we've talked about the reserve study. It is inadequate at best. And number six, we have had minimal discussion of how to pay for the several $100 million, if not more, IT costs, separate from the operations of IT, and why this time Oregon will do it differently. All of these are the concerns that I have, substantive concerns, and to the standards of a Finance and Revenue Committee, I do not think we should send this forward. I will vote no. I'm voting no on it because it says to the governing board and the transition committee, this is not up to the standards that it should have been. We know you're going to take it in and work on it, but as a Finance Revenue Committee, we don't think this is what should be coming forward to you. So, thank you.
Thanks, Jeff, for articulating those points. That's really clear. Charlie?
So I'm going to agree with almost all of what Jeff said. I would disagree with one of his comments and I would say, I have no idea about one of them, and that is, have we understated or overstated the expenses? If I listen to Chunwei and John, I would say we have overstated the expenses. We can get a lot more savings than what we put into it. My gut feeling, and if I listen to Milliman, I would say we've understated the expenses. And my gut feeling is, I don't know. But I would guess that it's somewhere in between that, and that we're probably closer to a correct amount of expenses than either Milliman or John or Chunwei would say. But I don't really know, and that would be nice to have an analysis. But otherwise, I agree with what Jeff said. But I think I'm still going to vote yes. Yeah.
Charlie, oh, well, I was hoping you'd vote no, but okay.
Yeah.
You may be right on the expenses. But since
Yeah.
we're in agreement on the 5 of the 6 points, my very second point was, we don't know because we don't have a statement of revenue and expense.
Yeah.
And just as a financial person, you know, I like to be cautious when I'm putting numbers out there. And this is not being cautious.
Okay, Mary Lou?
But I guess my question is, who or how would we have gotten, or will we get that number? We put out a contract with a large actuarial, that a large actuarial firm came back and did come up with, a range of expense that many of us question. What were the assumptions? What were the building blocks that got them to those 74 billion and the $80 billion? And have not, at least to my satisfaction, really understood whether they were building or asked to build a universal health plan as a public good, or if they were asked to build a large insurance company. And I think that makes a difference in what their estimations were and what they are. And we're sitting here with these competing things, with beliefs, strongly held beliefs, some with strongly held experience like Chun Wei. And I guess that's all I want to say, that I'm not sure who would have given that, Jeff, what other consulting firm, what other, I think Charlie went at it, I think in a really reasonable way, looking at data and NHEA and all payer, all claims and all of that, to say, how much are we spending now or then, and then build it forward, versus how much would we spend if we did things very differently. And
Yeah.
it's that very differently part that I think we can all sit and have our own opinions and debate about. But I do take that Chun Wei is the only person who really has real life experience on a very large scale with kind of what has really happened and transpired from his experience. So I'm still debating on how I'm going to vote.
Thanks, Mary Lou. I've tweaked my motion, so here's another go at it. So my motion is to recommend the basic revenue proposal presented with suggested language revisions, acknowledging that further work is needed to adequately address cost savings expected with the universal health plan. I think that's going to be my final for today.
Thank you, Cheryl. I'm kind of amazed how, with all of this discussion going back and forth, that you're sitting there and being able to put those words on paper or on the
I'm
screen.
trying my best, and I know
Thank you.
Richard seconded it, and I hope he's okay with that, the way I revised it. I think he's back with us now.
Yes, I am okay with it. Thank you.
Okay, all right, Chun Wei.
Just have a quick question, particularly for Jeff. Earlier,
Please.
both Jeff and Charlie mentioned about when we are proposing those revenue strategy, we are totally ignorant about what the actual cost may be. And I think, should we add that language in the amendment in submitting this proposal? What Jeff and Charlie, what do you think? To acknowledge our ignorance of what the expenditure might be.
I don't think, I wouldn't like adding that. I actually like the way Cheryl wrote it, that, yeah, more work needs to be done. Sort of. So yeah, I would say I'm actually liking what Cheryl ended up with there. So
Thank you. I'm going to go ahead and
Mike,
call the vote then.
I'm going to say my response to Chun Wei's question is, that's all the more reason for us to vote no, because it sends a much stronger message to the transition committee and the governance board that the work thus far is insufficient at best. Okay,
so I'm going to go ahead and call the vote. And So I said my motion, and so could we do the roll call?
Yes, Cheryl Ramirez,
Yes.
Chun-Wei Chi,
No.
Mary Lou Henrich,
Yes,
Richard Gibson,
Yes,
Jeff Goodman,
No.
John Santa. John, are you able to share your vote?
Gosh, I'm sorry. I'm really sorry.
It's okay.
No.
Bethany Steers is absent and Charlie Swanson.
Yes.
Okay, that's 4 yeses and 3 nos.
Passed barely. Okay, thank you all for that. I know that was difficult. Go ahead, Jeff.
I will be submitting a minority report.
Sure.
And just, I've covered the points, so don't need to repeat them now, but I will be submitting a minority report.
Okay. Mary Lou?
just wondering whether some of these various comments could somehow be gleaned and summarized and kind of like as a codicil to this thing or something that kind of says that, you know, that there was a lot of kind of, it was a very close vote, a concern of the committee. I don't know whether there's any possibility to kind of say a little bit about the flavor of what this was going forward. I mean, if somebody really cares, they can come watch this video. But I don't know if there's just, I feel like there was a lot of rich discussion that came from all sides. And it was difficult for me, I don't know, maybe the others, to really make a vote because there was kind of little pieces here and there that I had wished I could have said, well, no, not yet, not that, but this. But the overall, I'm comfortable with my vote. So I don't
I
know.
agree, Mary Lou. And I will certainly mention these differences. I'm going to say how the votes landed, that they were close. I imagine this will come out in Jeff's minority report. And I don't want to speak for the staff, but I would say in the revenue summary report that can be mentioned as well. So
Thank you.
I think there are different ways. And as you said, yeah, people can watch the recording too.
Yeah.
But we want to help the board, we want to help the public know that we struggled with these decisions, and we had some good discussions too. So
And the last chapter isn't written.
exactly, that's totally true. John?
Yeah, just a comment and then a clarification. I mean, Mary Lou, Cheryl, I think this is one of the best discussions we've had. And you know, disagreement is a part of life. And we've gone forward in the correct way, airing our concerns and then getting a sense of the group. And I think I accept the wisdom of the group. For myself, I must say that, you know, part of my decisions on how I voted was this is the end for me in terms of this process. Any authority or power I have is gone now. I'm pleased to see that oftentimes the folks on the other side are going forward with that power and authority. And so you've heard our concerns, and you know, I hope you act at least to some degree accordingly. One clarification. At the outset of the meeting, there was a comment about minority reports, and I think it suggested that the time for a minority report was in September, when the whole board had decided what it was going to do. Is that the case, or are there minority reports at the committee level, as I think Jeff has suggested he's going to pursue?
I think you can do both, and I'm sorry that was a little muddy at the beginning. You can certainly submit a minority report to the governing board's report they're submitting to the legislature. You can do that, but you can also submit a minority report for for this particular revenue proposal. That's fine too. And in terms of the timing, I don't know. I would ask Director McDonald to help us out with that in terms of when you need to submit that. I don't know.
Yeah, absolutely. I mean, I think at whatever point, I mean, I appreciate Jeff saying that you'll submit something. I do think that it would be best if it came from the person, you know, that to make sure that it is captured exactly what your thoughts are and concerns. So I appreciate you all, or if you have the opportunity to write something up, that's great. Thank you.
Go ahead, Charlie.
So I just want to make another comment that as someone who's worked as an advocate for a while, who would have ever thought that how we pay for a universal healthcare system would be a somewhat difficult and contentious issue?
Very funny.
You get the humor award, Charlie.
Yeah. So let's see. I just want to say something very quickly. I know we're running out of time, but I plan on taking all of these votes to the board meeting this Thursday. I will just give them the results of all of the different votes, what we agreed on and didn't agree on, and I will say, I will describe the discussion, and I've been jotting down concerns that were raised. I'll mention that too in my report. I don't know that help me out, maybe I don't know if the board will actually vote to accept our recommendations or if there's just too little time for them.
I think there's too little time
Okay,
because
all
we
right.
want to amend that basic proposal based on
Right.
the information that
Okay.
Charlie said and things like that. So although it is in their packet as a draft, so I think it'll be useful so you can bring it up and talk about it. But
Okay.
there should not be a vote.
So the board would be voting probably in April.
Yeah, that would make
That
more sense.
also gives us more time too, because Morgan's given you another 2 weeks to provide feedback on the report. So that way it'll be final, I would think, by the April board meeting, that is. Mary Lou?
I guess I just want to thank Chenwei for being able to be here today. I think that with his classes and all of that, this is probably a sacrifice on his part.
Yeah,
and so to have 3 of us as board members, you know, and when there's only eight board members, it's more than a third of the board that are here in this discussion. And I think that will be helpful also as you present this, Cheryl, and for us to be able to acknowledge and to, you know, if we have any finer points or we, you know, whatever, but
Yeah.
there were 3 of us in the room.
That's right. John?
I just wanted to make sure, so we voted for the amendment, or did we vote for the motion which adopted the friendly amendment? Because we only had one vote.
Yeah, we didn't vote on the amendment. I did tweak the wording to acknowledge what Chenwei was saying, that we didn't fully include the cost savings and more work needed to be done. So I did incorporate the wording. We didn't vote on the amendment per se.
Okay, so there was a change in the wording
Yes,
of
that's right.
the motion, not an amendment.
Right.
Right.
Okay.
And Cheryl made it. Yeah.
Just so we all have that right.
Jeff?
Thank you. First, I have enjoyed participating over the last 18 months in 30 meetings. Intellectually challenging, emotionally frustrating. Second is a plea to the Transition Committee and the Governance Committee. Stop punting. We punted on so many things today to the Transition Committee and the Governance Committee. Before it goes to the legislature, stop punting.
Thanks, Jeff.
Can I just
similar
quickly
experience.
quick
I just want to say I had a similar experience to you, Jeff, with the committee. Mary Lou, go ahead.
I want to clarify, Jeff, you keep talking about the governance committee. It is not a committee.
Oh, it's governance board.
Legislatively established board. And I think that, you know, some people can consider it almost like a task, or I hear it referred to in different ways. I think we just need to be clear. This is a legislatively established governance board to put forth a proposal. And all the pieces in that. So just wanted to clarify, it's not a committee.
Thanks for
Thank you.
clarifying, Maria.
Agreed. Transition committee and governance board, stop punting.
Thank you.
Okay, John.
Yeah, and I would just close with a comment that a colleague who I have a lot of respect for made describing our effort. He said, yeah, they've buttered a rock and called it a biscuit. Stop doing that. Stop doing that. Thanks.
With that, thank you. I wanted to say, I just wanted to give my profound thanks to, oh gosh, he's not, oh, there he is, Morgan. Thank you so much for all your work. We couldn't have done it without you. Having been here the whole 18 months, I feel like we were spinning a bit before you came on board. I also want to thank the wonderful staff of the Universal Health Plan Governing Board. Also couldn't have done it without you, relied on you so much. I know it was a really heavy lift to not only have one meeting a month, but two for most months. As Jeff indicated, we had 30 meetings total in 18 months. So most of those months had 2 meetings. So I just want to thank you so much. And I want to thank all the committee members and of course, Charlie and Richard for all your extra work in between meetings. That was a very heavy lift. I mean, just even reading all of the things that you were coming up with was hard on my brain. And I just cannot, not only I can't imagine what that took to keep doing all those iterations of all the things we were talking about. So thank you so much. I am very happy that you're moving on to the transition committee. They will really benefit from your expertise and all your work. And also Mary Lou, thank you also for volunteering to be on that committee as well. So that will be some continuity for sure from this committee. To your point, Mary Lou, you know, there are 3 of you moving forward with transition committee, and I don't remember how many people are on there, but not that many. So there's a significant a group of us who will be moving on. So thank you so much. Really appreciate all of you. I've learned a ton. And thank you for your commitment to Universal Health Plan. We all have the same goal, and we do want to get there. And so thank you. Mary Lou, did you want to say anything?
Just one last thing, that Larry Wallach, who was the dean of the Hatfield School of Government at Portland State and other things, for many years gave a talk where he said that people are either divided into you're on your own, which he abbreviated to be a yo-yo, or we're in this together, which he calls a wit. And so I am appreciative of all the wits that are in this group that are pushing this forward. We are together. We've got various opinions, expertise. I thank Cheryl. I know it's been hard for you to have kind of ended up chairing this thing. You know, that wasn't your first choice. And but you've despite all kinds of things, you've done a very good job. And I think especially in these last few meetings, I've really appreciated that even more. I just wanted to say we are in this together. And the same way with the staff and with going forward in the transition committee, there are days when I wonder, what did I volunteer to do? But overall, I can't give it up. And I eat and sleep and drink it. And I think most of the people on this committee, it's the same way. So, and thank you, Charlie, ever so much for what you've done.
I just want to say, Mary Lou, I can't agree with you more that we're in this together. We're either going to be successful or fail together. So
Right.
I appreciate that. And I also appreciate your kind words. Now, I know we don't have public comment, and it looks like Chen Wei Chi has a comment though. So go ahead.
Not a comment. I just, like Mary Lou, I want to express my deep appreciation to Cheryl and to Charlie and to everyone in the committee for your dedication and hard work. I appreciate very, very much.
Thank you so much, Chen.
And this is Richard. I'd like to thank Cheryl for heading up a challenging task. I'd like to really thank Morgan and the wonderful people at Echo Northwest for a great job for us. And I want to thank my committee members for hanging in there, and lots of work to do on the transition committee. And I'm looking forward to it. Thank you.
Absolutely. Thanks, Richard. And Chenwei, we really appreciate your expertise. I mean, there's nothing like having done this actually. So thank you so much. Okay, with that, I'm going to adjourn and thank you again for all your work. And I'm sure we'll be in touch, asking you all kinds of questions as we move forward. Thank you. Bye-bye.
Thank you.